What family medical emergency did your parents refuse to believe until it was almost too late? My sister Vanessa started complaining about stomach pain on a Thursday morning while we were getting ready for school. She was 16 and I was 14, and we shared a bathroom where I watched her double over the sink, her face pale and sweaty. She said it felt like someone was stabbing her in the lower right side of her stomach, but when I suggested telling our parents, she shook her head. They'd just say I was trying to get out of my history test, she muttered, straightening up with visible effort. Our parents had this thing about toughness, about not giving in to weakness or seeking attention through complaints. Vanessa was right, that they wouldn't take it seriously. By lunchtime, Vanessa texted me from her classroom saying the pain was getting worse. She'd gone to the nurse twice, but the nurse just gave her crackers and said it sounded like gas, or maybe her period's starting. I knew Vanessa's period wasn't due for another week because she tracked it religiously in her planner, always prepared with supplies and pain medication. This was something different. When we got home that afternoon, Vanessa went straight to her room and curled up on her bed, hugging her knees to her chest. I brought her water and she tried to drink it, but immediately ran to the bathroom and vomited. The sound of her retching made my stomach clench with worry. Our mother came home from work around 6 and found Vanessa still in bed, refusing to come down for dinner. Mom stood in the doorway of Vanessa's room with her arms crossed, that expression on her face that meant she thought someone was being dramatic. "What's wrong with you?" she asked in a tone that made it clear she expected the answer to be nothing serious. Vanessa explained about the stomach pain and the vomiting, and Mom's expression didn't change at all. "You're probably starting your period," Mom said dismissively. "Take some Tylenol and use a heating pad. You can't just lie in bed every time you have cramps, Vanessa. You need to learn to push through discomfort like every other woman does." I followed Mom downstairs and tried to explain that Vanessa seemed really sick, that she'd been in pain all day and the vomiting wasn't normal. Mom waved me off while pulling leftovers from the refrigerator, telling me that Vanessa had always been prone to exaggeration when it came to minor aches and pains. "She's dramatic about everything," Mom said. "Last month, she insisted she had the flu when it was just a cold. The month before that, she claimed she couldn't go to school because of a headache. She needs to stop looking for excuses to get attention and special treatment." I stood there feeling helpless, knowing that arguing would just make Mom more convinced that Vanessa was faking. Dad got home an hour later, and Mom filled him in on Vanessa's situation with an eye roll that communicated her complete lack of concern. Dad went upstairs to check on Vanessa and came back down shaking his head. He reported that she was being melodramatic about normal period symptoms, that she needed to learn pain management skills instead of wallowing in bed. He said when he was growing up, people didn't make such a fuss about routine discomfort. They just took an aspirin and got on with their responsibilities. Mom nodded in agreement, and they both settled in to watch television, like everything was fine, like their daughter wasn't upstairs in obvious distress. I snuck back to Vanessa's room after dinner and found her in worse condition than before. Her face had gone from pale to grayish, and sweat soaked through her shirt despite her shivering under 2 blankets. The pain had intensified to the point where she could barely speak without gasping, and when I asked her to rate it on a scale of 1 to 10, she whispered 11. I begged her to let me get our parents again, but she just shook her head. "They won't believe me," she said through gritted teeth. "They'll just get mad that I'm still complaining. You know how they are." She was right, but watching her suffer felt unbearable. That night, I barely slept, listening through the wall that separated our rooms as Vanessa moaned and shifted around, clearly unable to find any comfortable position. Around 3 in the morning, I heard her get up and stumble to the bathroom where she vomited again. The sound was different this time, wetter and more violent, and when she came back to her room, she was crying softly. I wanted to go to her, but I was frozen with indecision, torn between respecting her wishes and my growing certainty that something was seriously wrong. Every instinct told me this wasn't period cramps, but I was 14, and my parents had already dismissed the situation. What could I possibly do? Friday morning, Vanessa couldn't get out of bed at all. When I went to check on her before school, she was curled in the fetal position, her breathing shallow and rapid. Her skin felt hot to the touch, and when I pulled back the blanket to look at her stomach, I could see it was visibly swollen on the right side, distended in a way that looked completely wrong. I ran downstairs and told our parents that Vanessa was much worse, that her stomach looked swollen and she had a fever. Mom sighed heavily and said Vanessa needed to stop this nonsense, that she was going to miss school over regular period symptoms. Dad added that Vanessa was old enough to manage her own menstrual cycle without making it everyone else's problem. I stood in the kitchen doorway watching my parents eat breakfast and discuss their work schedules like their daughter wasn't upstairs, potentially dying. The disconnect between their casual morning routine and what I'd just witnessed in Vanessa's room felt surreal and horrifying. When I tried one more time to convince them this was serious, Dad snapped at me to stop enabling Vanessa's attention-seeking behavior. He said I was being manipulated by her dramatics, that sisters needed to support each other by encouraging strength instead of coddling weakness. Mom told me to hurry up and finish getting ready or I'd be late for school, and that Vanessa would be fine when she stopped feeling sorry for herself. The school bus ride felt endless as I sat there thinking about Vanessa alone in the house, suffering without help. I couldn't focus in any of my classes, just kept checking my phone for texts from her even though phones were supposed to be off during school hours. Around 10 in the morning, I finally got a message that just said, "Hurts so bad, can't move, help me." And my hands started shaking so badly I dropped my phone. My English teacher asked if I was okay, and I lied and said yes, but I couldn't stop thinking about that text. Vanessa wasn't dramatic. She played varsity soccer with a sprained ankle last season. She never complained about anything unless it was genuinely serious. At lunch, I called my grandmother from the bathroom, the only person I could think of who might actually listen to me. Grandma lived 20 minutes away and had always been more practical and less concerned with toughness than our parents. I explained everything that had been happening with Vanessa, how our parents thought it was just period cramps, but I was certain it was something worse. Grandma went quiet for a moment, and then asked specific questions about Vanessa's symptoms, where exactly the pain was located, whether she'd been able to keep any food or water down. When I described the swollen stomach and the fever, Grandma said one word that made my blood run cold: appendicitis. Grandma told me she was leaving her house immediately to go check on Vanessa, and that I should stay at school and not worry. But how could I not worry when Grandma's voice had that tight quality that meant she was scared? I spent the rest of lunch period and my next class in a state of barely controlled panic, imagining all the worst possibilities. When my phone buzzed during math class, I grabbed it immediately despite the teacher's sharp look. The text from Grandma said, "Taking V to hospital now. Parents notified. Very serious. We'll update soon." My vision blurred with tears and the teacher sent me to the nurse's office, probably thinking I was having some kind of breakdown. The nurse let me sit on the cot and call Grandma, who answered while driving. Her voice was tense as she explained that she'd found Vanessa in terrible shape, barely conscious and burning with fever. When Grandma had lifted Vanessa's shirt to look at her stomach, the swelling was even worse than I'd described. Hard and distended and hot to the touch, Vanessa had been vomiting bile, the green kind that indicates intestinal blockage. Grandma had immediately called an ambulance but then decided she couldn't wait, that Vanessa needed help right now. So she'd carefully gotten Vanessa into her car and was driving to the emergency room, while on the phone with 911, getting instructions on what to do if Vanessa lost consciousness. I begged the school nurse to let me leave, to call someone to come get me so I could go to the hospital. The nurse tried to calm me down, saying my grandmother was handling the situation, and I should wait until my parents arrived to pick me up. But my parents were at work and they'd already proven they wouldn't take this seriously, so why would they leave work to get me? I started crying harder, explaining that my sister might be dying and my parents had spent 2 days insisting she was just being dramatic about period cramps. The nurse's expression changed then, shifting from professional sympathy to genuine concern. She made a phone call to the principal and then told me she was driving me to the hospital herself. The emergency room was chaos when we arrived. People everywhere and machines beeping and voices calling out medical terminology I didn't understand. The nurse at the front desk directed us to the surgical wing, saying Vanessa had been rushed into emergency surgery about 10 minutes ago. My grandmother was in the waiting room, her face streaked with tears, and when she saw me, she pulled me into a crushing hug. She explained in a shaking voice that the doctors had done an immediate CT scan and found that Vanessa's appendix had ruptured, possibly more than 12 hours ago. The infection had spread throughout her abdominal cavity, causing sepsis. They'd rushed her into surgery to remove the burst appendix and clean out the infection, but the surgeon had warned that sepsis was life-threatening, and the next few hours were critical. My parents arrived 30 minutes later, both of them looking annoyed rather than worried. Mom immediately started questioning Grandma about why she'd taken Vanessa to the hospital without discussing it with them first, saying she'd overreacted to normal teenage drama. Dad complained about having to leave an important meeting for what was probably nothing serious. I watched Grandma's face transform from grief to fury as she interrupted their complaints. "Your daughter is in emergency surgery because her appendix ruptured," she said in a voice cold with rage. "The doctors said if I'd waited even another hour to bring her in, she would have died. Died. Because you two refused to believe she was actually sick." The silence that followed was absolute. A surgeon came out about 20 minutes later, still in his surgical scrubs with a mask hanging around his neck. He introduced himself as Dr. Hayward and asked if we were Vanessa's family. When Dad confirmed we were, Dr. Hayward gestured for us to sit down, which immediately made my stomach drop, because doctors only make you sit when the news is bad. He explained that Vanessa had suffered a ruptured appendix with significant peritonitis, meaning the infection had spread extensively through her abdominal cavity. They'd removed the appendix and flushed out as much infected fluid as possible, but she was in critical condition. The sepsis had advanced to the point where her organs were beginning to shut down. They'd transferred her to the ICU and started aggressive antibiotic treatment, but her survival wasn't guaranteed. Mom made a choking sound and grabbed Dad's arm. Dad's face had gone completely white, his earlier annoyance replaced by dawning horror. Dr. Hayward continued in a calm but serious tone, explaining that appendicitis typically starts with pain near the belly button that migrates to the lower right abdomen. Early symptoms include loss of appetite, nausea, vomiting, and low fever. If caught early, appendicitis is treated with a simple surgery and patients recover quickly, but if ignored, the appendix becomes so swollen with infection that it bursts, releasing bacteria throughout the abdominal cavity. Once that happens, The patient develops peritonitis and sepsis, both potentially fatal conditions. Everything he described matched exactly what Vanessa had been experiencing for 2 days, while our parents insisted she was being dramatic. Dr. Hayward asked when Vanessa's symptoms had started, and I spoke up before my parents could answer. I described in detail how Vanessa had complained of pain Thursday morning, how it had gotten progressively worse, how she'd been vomiting and feverish. I explained that our parents had thought she was exaggerating period symptoms and had given her Tylenol and a heating pad instead of medical attention. I watched Dr. Hayward's expression shift from professional neutrality to barely concealed disapproval as he glanced at my parents. So she exhibited clear symptoms of appendicitis for approximately 48 hours without receiving medical evaluation, he said, and it wasn't a question. My parents sat there in stunned silence, unable to defend their negligence. The ICU waiting room became our prison for the next 18 hours. Grandma and I sat together, holding hands and barely speaking. My parents occupied chairs across from us, not touching each other, their faces masks of guilt and fear. Nurses came out periodically with updates that were never good enough. Vanessa's fever was dangerously high. Her blood pressure was unstable. The antibiotics weren't working as quickly as they'd hoped. Her kidneys were showing signs of stress. Each update drove home the reality that my sister might die because our parents had dismissed her pain as attention-seeking. I kept thinking about Vanessa alone in her room Thursday night, suffering in silence because she knew our parents wouldn't believe her. The injustice of it made me want to scream. Around midnight, a different doctor came to update us. A woman with kind eyes and gray hair pulled back in a bun. She introduced herself as Dr. Ramirez, the intensivist overseeing Vanessa's care. She explained that Vanessa had stabilized somewhat, though she was still critically ill. The sepsis had been caught before it caused complete organ failure, which was fortunate. They were keeping her sedated to allow her body to focus on healing rather than on managing pain. She'd need to remain in the ICU for at least several more days, possibly longer. Depending on how she responded to treatment, Dr. Ramirez emphasized that the next 72 hours would be crucial in determining whether Vanessa would make a full recovery or suffer permanent damage from the infection. Then Dr. Ramirez did something I didn't expect. She asked my parents to step into a private consultation room for a conversation, and when they stood to follow her, she told Grandma and me to come as well. Once we were all seated in the small room, Dr. Ramirez closed the door and her expression turned grave. She said she had an obligation to report what she'd learned about Vanessa's case to the appropriate authorities. The 2-day delay in treatment for obvious appendicitis symptoms constituted medical neglect, especially given that Vanessa had explicitly complained of severe pain and other warning signs. A social worker would be coming to interview our family about the circumstances that led to this situation. My parents tried to interrupt, to explain, but Dr. Ramirez held up her hand. She said excuses didn't change the fact that a teenage girl had nearly died from a treatable condition because the adults responsible for her care had ignored clear medical emergency symptoms. The social worker arrived the next morning. A woman named Judith who carried a tablet and had a no-nonsense demeanor. She interviewed my grandmother first, getting the story of how Grandma had received my call, found Vanessa in critical condition, and rushed her to the hospital. Then Judith interviewed me, asking detailed questions about what I'd observed over the 2 days before Vanessa's hospitalization. I told her everything, including my repeated attempts to convince our parents that Vanessa needed medical attention, their dismissive responses, and their comments about Vanessa being dramatic and attention-seeking. Judith typed notes throughout my account, her expression neutral, but her fingers moving faster during particularly damning parts of the story. When Judith interviewed my parents together, I sat outside the consultation room with Grandma, unable to hear what was being said, but watching through the small window in the door, I could see my mother crying and my father gesturing emphatically, clearly trying to explain or justify their actions. The interview lasted over an hour. When it finally ended and my parents emerged, they both looked shell-shocked. Judith pulled Grandma aside for a brief conversation, and I saw Grandma nodding seriously. Later, Grandma told me that Judith had explained the investigation process. Child Protective Services would be opening a case to evaluate whether Vanessa and I were safe in our parents' care. The outcome would depend on multiple factors, including whether this was an isolated incident of poor judgment or part of a pattern of neglect. I was finally allowed to see Vanessa late Saturday afternoon, more than 24 hours after her surgery. A nurse led me to her ICU room and warned me that Vanessa looked worse than she was, that all the tubes and machines were helping her heal. But nothing could have prepared me for actually seeing my sister in that hospital bed. Vanessa looked tiny and fragile, her skin pale against the white sheets, tubes running from her arms and nose. Machines beeped steadily, monitoring her heart rate and oxygen levels. Her stomach was covered with bandages, and an IV bag dripped clear fluid into her veins. I sat in the chair next to her bed and took her hand carefully, afraid of disturbing any of the medical equipment. "I'm so sorry," I whispered, though I didn't know exactly what I was apologizing for. Maybe for not fighting harder to get her help sooner. Vanessa opened her eyes slowly, like her eyelids were weighted down. It took her a moment to focus on my face, and when she did, she tried to smile, but it came out more like a grimace. "Hey, little sister," she said, her voice hoarse and barely above a whisper. "You saved my life." I started crying then. All the fear and stress of the past 2 days pouring out, I told her about calling Grandma, about Grandma rushing to get her, about the surgery and the sepsis and how scared everyone had been. Vanessa listened quietly, tears sliding down her temples into her hair. She said she'd known something was really wrong but had convinced herself it couldn't be that serious, that if she just pushed through like our parents always demanded, she'd be fine. She'd been wrong, obviously, and now she understood how close she'd come to dying. The next few days established a routine. Grandma and I stayed at the hospital almost constantly, sleeping in the waiting room and eating cafeteria food. My parents came and went, both having taken time off work, but the atmosphere when they were present felt heavy and uncomfortable. They tried to talk to Vanessa when she was awake, but she mostly just looked at them without saying much. I could see the hurt and anger in her eyes, the betrayal she felt at having her pain dismissed for so long. Our parents tried apologizing, saying they hadn't realized how serious it was, but their words felt empty. They'd had numerous opportunities to take Vanessa's complaints seriously and had actively chosen not to. Sorry didn't erase that failure. By Wednesday, 5 days after her surgery, Vanessa had improved enough to be moved from the ICU to a regular hospital room. The sepsis was under control, her organs were functioning normally again, and she was able to eat small amounts of food without vomiting. Dr. Hayward came by during his rounds and expressed cautious optimism about her recovery. He explained she'd need several more days of IV antibiotics before she could go home, and even then she'd require weeks of rest and careful monitoring. The infection had been severe enough that she might experience complications down the line, possibly including adhesions or chronic abdominal pain. He also mentioned that she was lucky to be alive, that ruptured appendix with advanced sepsis had a significant mortality rate. The implication was clear. Another few hours of delay could have been fatal. Judith, the social worker, returned that Thursday, with another woman she introduced as her supervisor, Helen. They wanted to conduct a family meeting to discuss their findings and recommendations. We gathered in a conference room at the hospital, all 5 of us plus Grandma, who'd been included as Vanessa's advocate. Judith explained that their investigation had revealed this wasn't quite an isolated incident. While reviewing my and Vanessa's medical records, they'd found a pattern of our parents delaying or avoiding medical care for non-emergency issues. Vanessa had gone 3 years without a dental cleaning despite complaints about tooth pain. I'd had an untreated ear infection last year that eventually required stronger antibiotics after the initial infection spread. There were missed well-child checkups, delayed vaccinations, and notes from school nurses indicating both of us had been sent home sick only to return the next day without having seen a doctor. Helen took over the explanation, her tone firm but not unkind. She said the pattern suggested a general disregard for health concerns, possibly rooted in my parents' emphasis on toughness and their belief that children exaggerated minor ailments. While each individual instance might seem like poor judgment rather than neglect, collectively they painted a picture of parents who consistently failed to provide appropriate medical care. The Vanessa situation had simply been the most extreme and dangerous example. Helen explained that CPS was recommending a safety plan that would require my parents to complete parenting classes focused on recognizing medical emergencies, commit to regular checkups for both children, and submit to home visits from a caseworker for the next 6 months. If they failed to comply, or if there were any further incidents of medical neglect, Vanessa and I could be removed from the home. My father's face turned red and he started to argue, saying CPS was overstepping and treating them like criminals over honest mistakes. Helen cut him off calmly but forcefully. "Mr. Brennan," she said, "your daughter nearly died because you and your wife refused to seek medical attention for clear symptoms of a surgical emergency over a 48-hour period. Multiple people, including your younger daughter, tried to tell you something was seriously wrong and you dismissed all concerns. That's not an honest mistake. That's a dangerous failure of parental responsibility." The room went silent. Mom was crying quietly, her hands covering her face. Dad just sat there looking deflated, all his bluster gone. Vanessa stared at the table, her jaw tight. I felt oddly detached, like I was watching this happen to someone else's family. The safety plan was implemented immediately. My parents had to sign documents acknowledging the findings and agreeing to all requirements. A caseworker named Leonard would be visiting our home weekly initially, then transitioning to monthly visits if things went well. My parents were enrolled in a parenting course that met every Saturday morning for 12 weeks. They also had to take Vanessa and me for complete physical exams with a new doctor, one recommended by CPS, and maintain a file of all medical records and appointments. Any concerning symptoms reported by either of us had to be evaluated by a medical professional within 24 hours. No exceptions. Failure to comply would result in a court hearing regarding custody. My parents signed everything without much resistance, probably realizing they had no good options. Vanessa came home the following Monday, 10 days after her emergency surgery. She moved slowly and carefully, her stomach still tender, and the surgical incisions healing Grandma had essentially moved into our house to help take care of her since our parents both had to return to work. I'd missed a week of school and had mountains of makeup work, but my teachers had been understanding given the circumstances. The first few days at home were awkward and tense. Our parents tiptoed around Vanessa, asking constantly if she needed anything, if she was in pain, if she wanted food or water. Vanessa was polite but cold, accepting their help without much acknowledgement. I could feel the fracture in our family, this broken thing that might never fully heal. The first home visit from Leonard happened on a Friday afternoon, about 2 weeks after Vanessa's surgery. He was a middle-aged man with graying hair and a kind but observant demeanor. He toured the house, looked at our medical supply cabinet, asked to see the file of health records my parents were now maintaining. He interviewed Vanessa and me separately, asking how we were doing, whether we felt safe, whether our parents were following through on the safety plan requirements. I told him the truth, that our parents were being compliant, but the emotional damage lingered, that Vanessa barely spoke to them, and I found myself unable to trust their judgment about anything. Leonard nodded and took notes, saying that rebuilding trust would take time and possibly family therapy. The subject of therapy came up at the next parenting class my parents attended. The instructor had apparently suggested that our whole family would benefit from counseling to address the communication breakdown and trust issues. My parents brought home information about family therapists, and we had an awkward dinner conversation about whether we were willing to try it. Vanessa said flatly that she'd go if ordered to, but she wasn't interested in sitting around talking about feelings with people who'd almost let her die. Mom started crying again, something she did frequently now, and Dad just looked tired. I said I'd try therapy if it meant helping our family function better, because the current situation where we all lived in the same house but barely spoke felt unbearable. Eventually, we agreed to at least meet with a therapist once to see if it might help. The therapist, Dr. Kwan, met with us individually first before agreeing to family sessions. She was Asian American, probably in her 40s, with a calm presence that immediately put me at ease when it was my turn for an individual session. She asked me to describe what had happened from my perspective, not just the medical emergency, but the entire family dynamic that had led to it. I found myself talking for nearly the entire hour, explaining our parents' obsession with toughness, their dismissal of any complaints or discomfort, their belief that acknowledging pain or illness was weakness. I told her about watching Vanessa suffer for 2 days, while our parents insisted she was being dramatic, about my helpless frustration at being 14 and unable to override adult decisions even when I knew they were wrong. Dr. Kwan listened attentively and asked clarifying questions that showed she was really processing what I said. At the end of the session, she told me something that stuck with me. She said that what had happened to Vanessa was a systems failure, not just a single bad decision. Our parents had created a family culture where expressing vulnerability or needing help was treated as character failure. That culture had set up a situation where Vanessa felt unable to advocate forcefully for herself, and where our parents couldn't hear warnings because they'd trained themselves to dismiss health concerns. Fixing this would require our parents to fundamentally change how they thought about strength and care, which wouldn't be easy or quick, but it was possible if everyone committed to the work. The first family therapy session was uncomfortable and stilted. Dr. Kwan had us sit in a circle and established ground rules about respectful communication and not interrupting. She asked my parents to describe their perspective on what had happened. Dad talked about how they'd genuinely believed Vanessa was exaggerating menstrual symptoms, that they'd seen her be dramatic about minor issues before, and assumed this was the same pattern. Mom added that she'd experienced severe period cramps as a teenager and had been told by her own mother to just deal with it, so she'd applied the same logic to Vanessa. Neither explanation felt adequate, but at least they were trying to articulate their thought process rather than just apologizing vaguely. When it was Vanessa's turn to speak, her words came out angry and hurt. She said she'd spent 2 days in the worst pain of her life, begging for help while our parents told her she was weak and dramatic. She'd actually started to doubt herself, wondering if maybe she was overreacting, if period cramps really were this bad and other girls just handled them better. Even as her appendix was rupturing and poison was spreading through her body, she'd been trying to be tougher, to stop complaining, to live up to our parents' impossible standards, and she'd almost died because of it. Now she didn't know if she could ever trust them again with anything important because they'd proven they'd rather believe she was faking than acknowledge something might be genuinely wrong. My turn to speak came next, and I talked about the helplessness of being 14 and watching my sister suffer while being unable to do anything meaningful to help her. I'd tried telling our parents something was wrong, tried advocating for Vanessa, and been dismissed just as thoroughly as she had been. I explained how that experience had damaged my trust not just in our parents, but in my own judgment. Because if the adults in my life wouldn't listen to my legitimate concerns, maybe I wasn't as capable of assessing situations as I'd thought. Dr. Kwan pointed out that actually my judgment had been correct, and my actions in calling Grandma had likely saved Vanessa's life, but I still struggled with feeling like I should have done more, done it sooner, fought harder against our parents' dismissiveness. Over the following weeks, therapy sessions became a regular part of our routine. Dr. Kwan worked with our parents on recognizing their problematic beliefs about toughness and pain, helping them understand that teaching resilience didn't mean ignoring genuine medical needs. She had them practice active listening exercises where they had to repeat back what Vanessa or I said before responding, forcing them to actually hear our words instead of filtering everything through their preconceptions. She assigned homework like having our parents research common medical conditions in teenagers so they could recognize symptoms better. Progress was slow and often frustrating, but it was progress nonetheless. Vanessa's physical recovery took longer than anyone expected. The sepsis had been severe enough to cause some lingering complications. She developed adhesions in her abdomen, bands of scar tissue that caused periodic pain and digestive issues. She missed 6 weeks of school and had to withdraw from soccer season entirely, losing her position on the varsity team she'd worked so hard to earn. Her college athletic scholarship hopes, which had been strong before the appendicitis, were now uncertain at best. The anger she felt about these losses was palpable and justified. Her future had been altered because our parents couldn't admit she was genuinely sick. No amount of apologies could give her back what she'd lost. The caseworker visits continued monthly as promised. Leonard would show up unannounced sometimes, checking to make sure our parents were maintaining proper medical care. He'd ask to see documentation of our recent checkups, ask us privately if we felt safe and cared for, observe family interactions during his visits. My parents clearly resented the intrusion and oversight, but they complied because the alternative was worse. I actually found Leonard's visits somewhat comforting. Knowing someone official was watching to make sure our parents followed through on their commitments, Vanessa seemed to feel the same way, becoming more talkative during his visits, maybe because she knew he took her concerns seriously. School was difficult for both of us when we returned. Word had spread about what happened, probably through the school nurse or teachers who'd been contacted by CPS. Students would stare and whisper, and more than once I overheard someone say something like, "That's the girl whose parents almost let her sister die." Some kids were sympathetic and kind, asking if Vanessa was okay or offering to share notes from classes she'd missed, but others were cruel in the way teenagers can be, making jokes about Vanessa being dramatic or suggesting she'd faked the whole thing for attention. I got into my first and only physical fight, defending Vanessa's honor against some jerk who said she'd probably just eaten too much and made herself sick. The fight got me suspended for 3 days, but I didn't regret it. The parenting classes my parents attended apparently covered not just medical neglect, but broader patterns of emotional neglect and harmful parenting practices. They came home from one session visibly shaken, explaining that the instructor had shown case studies of families whose emphasis on toughness and emotional suppression had led to children with anxiety, depression, and inability to form healthy relationships. Apparently, our family dynamic fit several of the problematic patterns discussed. My parents seemed genuinely disturbed by this realization, like they'd thought they were raising us to be strong, and instead had been setting us up for psychological damage. Better late than never for this epiphany, I guess, though it didn't undo years of being taught that needing help was weakness. About 4 months after Vanessa's hospitalization, we had a significant breakthrough in family therapy. Dr. Kwan had been pushing my parents to do something she called a repair conversation, where they would fully acknowledge the harm they'd caused without making excuses or asking for forgiveness. My parents had been resistant, clearly uncomfortable with the vulnerability required. But during one session, Dad broke down crying while trying to articulate how sorry he was. He said he'd been raised by parents who believed suffering built character, that showing pain or fear was shameful. He'd internalized those beliefs and passed them on to us without examining whether they were actually healthy or helpful. He'd been so committed to raising tough kids that he'd failed to see when toughness became cruelty. Mom's breakdown came next, her own tears mixing with Dad's. She talked about being a woman in a male-dominated workplace where showing any weakness meant being dismissed or overlooked. She'd learned to ignore her own pain and discomfort, to push through injuries and illness without complaint, because that's what survival required. She'd thought she was teaching Vanessa and me to be strong women who could handle anything. Instead, she'd taught us that our pain didn't matter, that asking for help was failure. And when Vanessa had desperately needed help, Mom had been so trapped in her own dysfunctional beliefs that she'd nearly cost her daughter everything. The raw emotion in these admissions was painful to witness, but also somehow necessary. Vanessa's response surprised everyone. Instead of accepting the apologies or expressing forgiveness, she said she needed time to figure out how she felt, that she couldn't just flip a switch and trust them again after what they'd done. She acknowledged they seemed genuinely remorseful, but remorse didn't erase the trauma of being ignored while her body was shutting down. It didn't give her back the soccer season she'd lost or the scholarship opportunities that had evaporated. It didn't undo the nightmares she still had about lying in bed vomiting bile while our parents told her to stop being dramatic. She needed to see sustained change in their behavior before she could begin to rebuild trust, and that would take time, possibly years. Dr. Kwan praised Vanessa for this honest response, saying that healthy boundaries meant not accepting superficial apologies just to make others comfortable. The 6th-month review with CPS arrived in mid-spring. Leonard compiled his reports from all the home visits, reviewed medical records showing we'd been taken for regular checkups, and interviewed our family one final time. His recommendation to his supervisor was that the safety plan had been successful in changing our parents' approach to medical care, but that the underlying family dysfunction would require continued therapy to address. He suggested extending CPS oversight for another 6 months to ensure the changes stuck, and recommended our parents continue family therapy for at least another year. Helen reviewed Leonard's recommendations and agreed, filing paperwork that would keep our case open, but downgrade it from high risk to monitoring status. My parents' reaction to this news was mixed. They were relieved that CPS didn't find them to be ongoing dangers to us, But frustrated that they'd have another 6 months of oversight, Dad in particular seemed to feel like they were being punished excessively for one mistake, conveniently forgetting that the one mistake was actually a pattern of neglect that had nearly killed Vanessa. Mom was more accepting, saying if this was what it took to prove they'd changed, they'd deal with it. I noticed they were more careful about their complaints around Vanessa and me, probably realizing we could report anything concerning to Leonard. That wariness stung a little, like we were adversaries now instead of family, but maybe that dynamic was necessary for a while. Vanessa finished her junior year having missed significant chunks of education, but her teachers had been accommodating and she managed to pass all her classes. She couldn't play soccer, but started working with the athletic trainer on exercises to prevent adhesions from getting worse, hoping she might be healthy enough to play senior year. She'd gotten quieter and more serious after everything that happened, less quick to laugh or joke around. I missed the lightness she used to have, but understood why it was gone. Almost dying because the people who were supposed to protect you refused to believe you would change anyone. I dealt with my own changes, becoming more assertive about my needs and less willing to accept dismissive responses from authority figures. If I said something hurt or felt wrong, I insisted on being taken seriously, and if adults tried to brush me off, I'd escalate until someone listened. The extended CPS oversight period passed without major incidents. Our parents attended family therapy religiously, completed their parenting classes with perfect attendance, and ensured Vanessa and I had all recommended medical care. Leonard's visits became shorter and more routine, just check-ins rather than investigations. By the 1-year anniversary of Vanessa's hospitalization, Helen decided to close our case entirely. She met with our family one final time to explain that while CPS oversight was ending, the expectation was that our parents would continue the behavioral changes they'd implemented. Any future reports of medical neglect would be taken extremely seriously given the documented history. She also strongly encouraged continuing family therapy even without the CPS mandate, saying the work we'd been doing was important and shouldn't stop just because oversight ended. Vanessa did play soccer her senior year, though not at her previous level. The adhesions limited her mobility and caused pain when she pushed too hard, but she refused to quit entirely. She adapted her playing style and mostly came off the bench for specific situations, rather than starting every game. College scouts still came to games, but she'd lost her edge against girls who'd been training consistently all along. The athletic scholarship dreams died quietly, replaced by plans to attend state university on academic merit instead. She handled the disappointment with a maturity that seemed too heavy for someone barely 18, talking about how sometimes life doesn't go as planned and you just adapt and move forward. I hated that she had to be this philosophical about losing something she'd worked toward her whole life. Our parents tried hard to be better, I'll give them that. They asked regularly how Vanessa and I were feeling, took concerns seriously even when they turned out to be minor, never again dismissed pain or discomfort as weakness. But there remained a distance in our family that hadn't existed before, a wariness and lack of easy trust. Vanessa especially kept them at arm's length emotionally, sharing logistics and practical information but rarely confiding deeper thoughts or feelings. I fell somewhere in between, willing to maintain relationship with our parents, but never again assuming they had my best interests at heart, or that they'd make good decisions in crises. Grandma remained our go-to adult for anything serious, the person we trusted most to actually listen and help, rather than judge or dismiss. Dr. Kwan worked with us on accepting that our family would never return to whatever normal had been before. That version of our family had been built on dysfunctional beliefs and poor dynamics that had finally collapsed under pressure. The new version we were building had healthier foundations, but also carried the weight of betrayal and trauma that couldn't be wished away. She said some families never recover from breaches of trust this severe, and the fact that we were still together and working on repair was actually significant. Whether we'd ever achieve genuine closeness again remained uncertain, but functional civility with occasional warmth was a reasonable goal. This felt depressing when she said it, but also realistic. Vanessa graduated high school with honors and left for college that fall. She'd chosen a school 4 hours away, far enough that she'd only come home for major holidays. I understood she needed distance from our parents and the memories associated with home. We stayed close through text and video calls, probably closer than before actually, bonded by shared trauma and the knowledge that we'd survived something terrible together. She told me once that she'd forgiven our parents intellectually, understood they'd been trapped in their own unhealthy beliefs and hadn't meant to harm her, but emotional forgiveness was different, harder. Maybe impossible. She didn't hate them, but she also didn't love them the way daughters are supposed to love parents. They'd become people she was related to, rather than people she trusted or confided in. I'm a senior now, navigating college applications and thinking about my own eventual departure. My relationship with our parents has stabilized into something cordial but careful. We coexist reasonably well, and they've maintained the changes they made. But I know I'll follow Vanessa's example and choose a school far enough away for significant independence. The experience of watching my sister nearly die while our parents denied reality taught me that adults aren't always right, that sometimes you have to trust your own judgment even when authority figures dismiss you, and that protecting people you love might mean going against the wishes of people who are supposed to protect you. These are lessons I wish I'd learned differently, but I carry them forward anyway. Sometimes I think about that Thursday morning when Vanessa first complained about stomach pain, and I wonder what would have happened if I'd called for help immediately instead of respecting my parents' dismissal. Could I have prevented the rupture? Would earlier intervention have saved Vanessa from sepsis and all the complications that followed? The rational part of my brain knows I was 14 and powerless, that the responsibility lay entirely with our parents. But the guilty part that lives in my chest still whispers that maybe I could have done more, been louder, fought harder. Dr. Kwan says this kind of survivor's guilt is normal but not productive, that I need to forgive myself for being a child in an impossible situation. I'm working on it. The medical bills from Vanessa's hospitalization and surgery totaled over $80,000 even with insurance. Our parents paid them without complaint, probably understanding that objecting would make them look even worse. The financial stress added another layer of tension to our household, but they never once suggested Vanessa should feel guilty about the cost. At least they understood that much, that they'd created this situation through their negligence, and the consequences were theirs to bear. The money will probably take years to pay off, but that seems appropriate somehow. They should carry the weight of what happened for a long time. Vanessa's story became something of a cautionary tale in our community. The hospital used it in training materials about taking patient complaints seriously, regardless of age or perceived drama. The school district updated their protocols for when nurses should insist students see doctors, rather than just calling parents. Our family therapist, Dr. Kwan, even wrote a journal article about the case, anonymized, of course, examining how cultural beliefs about toughness can create dangerous blind spots in parental care. I'm glad some good came from Vanessa's suffering, that maybe her experience will prevent other kids from enduring the same dismissal and neglect. But it doesn't change what happened to her, what was stolen from her by parents who cared more about their philosophy of strength than their daughter's survival. Thanks for watching till the end. Make sure to subscribe and like to not miss the next story.